Welcome, everyone. Today we're diving into Hashimoto's thyroiditis, a common yet often misunderstood autoimmune disease. By the end of this session, you'll know what it is, why it happens, and how to manage it effectively. Hashimoto's, or chronic lymphocytic thyroiditis, is when your immune system mistakenly attacks your thyroid gland. This leads to inflammation and a decline in thyroid hormone production, resulting in hypothyroidism. In simple terms, your immune system sees your thyroid as a threat. This causes a gradual shutdown of the gland that controls your metabolism and energy levels. The main culprits here are antibodies, especially anti-thyroid peroxidase and anti-thyroglobulin antibodies. These antibodies damage thyroid tissue, leading to chronic inflammation. At first, your thyroid may swell, forming a goiter, but over time it can shrink and become underactive. Hashimoto's develops slowly, often taking years before symptoms show up. It can affect anyone, but it's most common in women aged 30 to 60, about 10 times more than in men. Risk factors include family history of autoimmune diseases, hormonal changes, and chronic stress. Genetics may load the gun, but the environment often pulls the trigger. Hashimoto's can start quietly, with a painless swelling in the neck from an enlarged thyroid. As hormone levels drop, symptoms like fatigue, weight gain, and cold intolerance may emerge. Women might face menstrual irregularities or infertility, and many experience depression or brain fog. Every cell in your body relies on thyroid hormones, so when they drop, everything slows down. Diagnosis starts with clinical suspicion, confirmed by lab tests. Typically, TSH levels are elevated as the pituitary tries to stimulate a failing thyroid. Free T4 is low, confirming hypothyroidism, and antibodies are usually positive, indicating an autoimmune cause. A thyroid ultrasound may reveal a shrunken or irregular gland, confirming Hashimoto's. If left untreated, Hashimoto's can lead to serious complications like severe hypothyroidism or heart disease. The main treatment is thyroid hormone replacement with levothyroxine, taken daily on an empty stomach. The dose is tailored to your age, weight, and lab results, and when managed well, energy and metabolism can return to normal. Monitoring TSH levels is crucial, especially after any dose changes. Patient education is key. Understanding the importance of medication adherence and timing is vital. Be aware of signs of under or over replacement, like fatigue or weight changes. Encourage balanced nutrition and regular exercise to support overall well-being. Emotional support is also important, as chronic fatigue can impact confidence and quality of life. With proper management, the prognosis is excellent. Most people can live normal lives. Ignoring treatment, however, can lead to severe complications and a sluggish life. To sum it up, Hashimoto's is an autoimmune destruction of the thyroid, leading to hypothyroidism. Diagnosis is confirmed with elevated TSH, low T4, and positive antibodies. Levothyroxine therapy is safe and effective when taken consistently. A sluggish thyroid doesn't mean a sluggish life. Hashimoto's can be managed with the right care. Thank you for listening, and remember to care for your thyroid. It will take care of you.